Join me in the pledge. The legs in the back corner.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, our first item is public comment. I would invite anybody wanting to say something, come on up and go ahead and make some comments. Do you have anybody coming up? Hi, just state your name and you can do it right there.
So I'm Tanya Albertson. Can I pull this down a little bit so I can talk?
Yes.
Those of us here tonight represent a larger group of employees who are at risk of losing their jobs, all because we don't want to take a vaccine, which should be medical freedom. We love our jobs and we love to take care of people. We work very hard making sure our patients have complete care, whether it's in the clinic, outpatient lab, radiology, ED, and acute, as well as our other supporting staff. We work in healthcare knowing the risks that we take every day. We strongly believe we can keep doing what we are doing and keep people safe. Let's face it, we rocked 2020. It will be important to remind staff to wear their masks, wash their hands, and when they are sick, to stay home. All departments need to be willing to work in other areas of the hospital like last year. The MAs with Deborah worked the tent and helped with testing, as well as other departments helping with screening. If we all work together, we can keep the hospital running smoothly. Remember that whether we have the vaccine or not, we can all get the virus. And are people going to get sick, including staff? Yes. Are people going to die? Yes, unfortunately. We believe in medical freedom. We choose not to take the vaccine. Please advocate for us so that we have freedom and the privilege to continue to serve our community. As a group of employees, we would be happy to work with the health district to formulate letters, advocacy statements, and further plans to escalate our concerns. Either way, we will ask the same of our legislative government to the best of our ability and our capacity. And I do want to thank the administration for working to come up with solutions this week that will help hopefully keep us moving in the right direction. Thank you.
Thank you.
Any other comments? Gerald, did you have something you wanted to say?
Yes, I would just like to say under comments, it just seems like we're trying to get one size that fits all. And my hope is that there's some way that we can convince the governor that the closer to the people we have representation, the better that we're going to be served. Seems a little harsh, a vaccine to your job. I was chatting with one of my grandsons who has 3 young children, and in the course of the conversation, like so many times, the COVID things comes up. His comment was, well, it seems like maybe the governor got out the stick instead of the carrot. If you want your kids to go to bed, you don't often say, I'm going to paddle you and start with that. You start with maybe a cookie and milk. And I wish that maybe we could convince the governor of that kind of a concept. If we do and behave and have the results that maybe she would set for us, then I would hope that we would be able to do it in a manner that would serve both our county, our state, and our nation. And we have three things: equipment, we have buildings, and we have personnel. And without you, we just have an empty building and machines that sits. I hope that you would work with us. I thank you for your comments. I think that hopefully we can work this together. Things change daily, and just I hope you don't react too soon. I hope you know that the administration and the board, we want what is best for Lake County, otherwise we wouldn't be here to help serve. Thank you.
You're welcome. Any other comments? Yes, sir.
Well, I totally agree with what Gerald said and heard. Each and every one of us come here every day because we want to. I worked 1.5 years to even get hired here. This was a dream job, someplace I wanted to work, and I have a past. And as you know, pasts stay with you your whole life. And it took me 1.5 years of working, pushing, talking, writing letters and all that before I was even hired. I'm working dietary, I'm the night chef. But I did 1.5 years as a dietary aide. And part of that is I visited the patients the acute patients every single day and talked to them about their dietary needs and reactions they were getting to the food and whatnot. And there was plenty of times when there was people in isolation, and I chose to go in and visit with them irregardless. And that's a personal choice. I'm old. If I go tomorrow, I've had a good life. But there's a lot of people here with kids, and they can't afford to not have a job. And they love what they do. Every single person in here truly enjoys what they do. They go into the rooms knowing that they can get infected. They know that they can die. But the choice, and that's the key thing, the choice is they make the decision whether to go in that room or not. And Charlie would never, ever come up and say, if you don't go in that room, you're fired. Never. Would you, Charlie?
You said it well.
And I do appreciate you standing up and taking the shots last week. I think that was a very, I think all of us respect you even more. None of us believe it's your fault. But you are the focal point of where, this is highly emotional and everybody's life is at stake here, so to speak. And you're the place where we got to bring everything. So unfortunately, sometimes it gets a little on the abrupt side, and I apologize for those that were. But, we're family. The numbers don't lie. Lake County, through this whole deal, has been extremely unique to the state of Oregon. It's been unique to pretty much any other place in the United States. And I can't tell you the reason. Charlie asked during the meeting last week or 2 weeks ago, what do you think the reason is? I think it's because everybody here has enough sense about them to do the things that they know are right. But after a period of time, some of these things are not right. I firmly believe that our supervisor said, in your heart, you know. You look at the numbers, and something stinks. And there's a lot of stink going on in this. And just because we are very unique in our numbers here. And I think we will continue to be so because most of our people are pretty intelligent. And I just hope that you as the board and the administrative staff, it takes a lot of guts for these people to stand up, and myself, to tell you that, this is something we're standing for, but this is what our whole country was based on. We were legislated what tea to drink and, what church to go to and all of that. And that's why America's, now the United States is what it is. That's what we were founded on. And here again, we come to an issue that's very, very highly full of bull, to be honest. the most of us do not have any hesitance in refusing the ingredients that come with the injections. The other part is somebody standing over us with the club telling us we have to. I just wasn't wired that way, I'm sorry. If you can show me where I can do anything in the world to save one patient, I'm all over it. Let's go. But our numbers prove different. And I just thank you guys for listening to us, and I thank everybody for being here. This is maybe one of the most important issues in our lives. And, you know, for me it probably is. And I'm glad to be a part of this family, and I hope it don't stop.
Thank you, Marty. Thank you. Appreciate that. And, you know, I realize that the OIRs kind of fly in the face of personal responsibility. That, you know, being mandated to do these things is probably the wrong way to go. However, it's the law. And until the law changes, we're obligated to follow the law. Following the law is, you know, very biblical, but it's also practical. And the way to change the law is to go to the top and get it changed there. We're happy to try to help that changing of the law, but there's nothing this board can do except to follow what the law says. I know that we're all free to make any choice that we want. We're not free to exempt ourselves from the consequences, whether they're good or bad. We do have the way of the religious exemption and medical exemption very easily done. They've done away with testing, so for those that have a religious or medical exemption, it's fairly easy to continue to work, but you're going to be masked. You're going to have the social distancing. You've got all the other stuff that they're going to require that we normally would do anyway. So I can leave it at that. I don't think that this law crosses the boundary of being immoral, but it is certainly difficult. And I'm not sure that it is the defining moment of our time, but it's certainly a significant one. So, any other comments?
My name is Deborah, and I'm a registered nurse, and I'm very proud to be in Lake County, and I appreciate what you said, except I feel my heart dropped when you said, as a board, we're not going to do anything, we can't do anything.
No, we're glad to help with a petition or something. If you want to give us a letter, I'll be happy to sign.
Okay, because I know it's a law, but who made that law? Because if you remember in the original law of Oregon, vaccines cannot be mandated. So somebody came along and changed that law recently, but I'm not really good on politics. So I'm just
not
here
an attorney and I can't answer that.
Yeah, I'm just here to hope that the board would be like, when the prison was in trouble, we had entities all over the great county that we had that got together with enough information and finally got the governor around to listen, and presented great cases. So I was just here tonight to hope that the board understood how serious this mandate is for so many people. And that it maybe if we can help you make a plan, we're all on board to hoping that you as a hospital board would make a plan to help us convince Kate Brown that a choice is needed. I'm not a good speaker either, so thank you.
I appreciate that.
Thank you.
Our team is headed by Charlie Twade, our CEO, and he is, as you know, the point man in all of this for the entire hospital team. So we can work with Charlie and with you on getting something out. Okay. Any other comments?
I think it better be sooner than later.
What's that?
It better be sooner than later because time is flying.
Yes, it is.
We need to get it done fast. in a timely manner.
We hear what you're saying, absolutely.
Do you want me to address any of the COVID latest?
Yeah, do we have anything new? I know that they did away with the testing mandate.
So there's a couple things that I can let everyone know of. I think it's important for everyone to understand. Can you hear me? Otherwise, I will wear my mask. No, it's not COVID, it's just. There are a lot of things that are going on that everyone should understand what's driving this decision and where the process is. So, as you can imagine, I spend an enormous amount of time dealing with this because it's not just our issue, it's an issue throughout the state and throughout the whole area, country. There are 7 regions in Oregon that are broken up by the hospital system. So region 1, for example, is OHSU. We're in region 7. And region 7 includes Klamath County, Klamath, Lake, Hardy, Grant, Deschutes, Crook, no, not now here.
What about Jackson?
Jackson County. Region 2 is Salem. Region 3 is Peace Health predominantly, but in the area south between Salem and Portland and some of the outer areas. Region 4 is the southeastern part of the southwestern part of the state, which is predominantly the Asantes, Ashland, Medford, Grants Pass, and I believe it includes Curry and Bay Area Hospital. What's important to know, as of yesterday, there were 95 patients, COVID patients at OHSU, and they were on a complete divert. They were diverting ambulances because they were full. Salem was at 103%. Peace Health was, they now were, in their ICU were going to 1 nurse to 6 patients.
What is the normal?
A 1-to-1. Asante was, they had 50 patients in their ICUs, the 3 hospitals. Sky Lakes had 22 COVID patients. Hardy had 5 COVID patients in-house. And Lake County was not anywhere near as full as that. So what's happening throughout the state is the hospitals that we refer to are so overwhelmed that we can't get patients out of here if they're in a dire condition. Now, that doesn't always matter to us because we don't have that many patients that we have to ship out. But if it is a person, we've got to figure out how to deal with it. I think Teresa was saying that we got 2 calls yesterday or the day before, yesterday, from Idaho asking if we would take a patient because they couldn't get a patient out. In Bend, they were at 100% of capacity. People that said, oh yeah, that's because they don't have enough staff. Well, Deschutes County announced that they were buying a refrigerated truck to park outside of the hospital. And that wasn't for the health of patients. They're overwhelmed. So when we talk about trying to convince the governor or the Oregon Health Authority to relieve hospitals of the burden of being vaccinated in the major metropolitan areas, it sort of falls on deaf ears. They're not terribly interested in hearing what we have to say. They don't necessarily always listen to what we have to say anyway, as you can imagine. So we have to think about what is it going to take for the rules to get changed. Now, Deborah said the rule was changed because there was a law in place, right? So let me explain what that law really did. Back in 1989, the legislature approved a law or a bill that forbid hospitals or healthcare institutions from mandating a vaccination. All other states in the United States don't have that. But that doesn't exempt any other employers from mandating, just healthcare institutions, okay? So the school district is not a healthcare institution, and they can, if the school district wants to mandate, they can. Nike, if they want to mandate everyone gets vaccinated, they can in the state of Oregon. I think I said the other night, OHSU has a real problem because the schools have mandated that they can vaccinate, but OHSU is also a hospital. How do they manage that? Kaiser Permanente has mandated throughout their entire company, all of their healthcare institutions, all employees have to be vaccinated, or you can't work for Kaiser. The only place that couldn't get put into effect is the state of Oregon. So when the governor changed and said, this is the mandate, Kaiser said, great, we've been doing this. Providence said, okay. Peace Health said, okay. In fact, Peace Health, their company, and they own several hospitals in Oregon, several hospitals in Washington and in Alaska, mandated as of September 1, all employees have to be vaccinated or they can't work for Peace Health. And that went into effect 2 days ago, or yesterday. So when we try to convince the governor that we want to be treated differently, we have to think of a good argument for why that is. Now we could say, well, it's because we don't have a lot of COVID cases, and therefore we should be fine. We should just be able to do whatever we want. Our case counts are beginning to rise. We need to be careful and thoughtful about it. As I said the other night, one of our responsibilities, my responsibility, is to ensure that every employee that works here has a safe environment, or I'm not living up to my responsibility. We ask everyone to wear masks. We ask everyone to wash their hands wherever possible, social distance. As Marty will tell you, not everybody does it. Hard to make people do that. It's hard for you to hear if I'm wearing a mask. But we have a responsibility to follow the rules. We could try to change the rules, but we also have a responsibility as an organization to follow the rules. We can't pick and choose the ones we like. We have to follow the rules. Now, what do we think as a practical matter is going to happen? I think the governor's office and the Oregon Health Authority has done to try and accommodate those people that don't want to be vaccinated is they have become very loose in the exemption process. Originally, when the rule came out in 3 weeks ago? It was unclear what kind of form needed to be signed and under what rules that form needed to be signed under. Some of the federal rules state that if you're going to apply a religious exemption, you need to have it signed off by the pastor of your church. If it's a medical exemption, you have to have it signed off by your physician saying, this is a very critical reason to justify this. There was also some concern that all of those signatures and all of those forms that were filled out asking for an exemption were going to be required to be approved by the state. What the state did is said, that's not going to happen. What they said is, as an organization, our responsibility is to ask every employee to either get a vaccination or complete a request for an exemption. We maintain that copy, we don't show it to anybody, we have it on file. What that says is, it's in everyone's conscience to decide what they want to fill out and how they do it. The second part about that is, we don't have to go through, as Don said, the testing. Testing would be very difficult, timely, and expensive. And the state said, you don't have to do that. Now, there is some discussion about seeing if the governor will move the date from October 18th to a later date. I don't know if that'll ever happen. We have to plan as though that isn't happening. If we don't do that, October 17th is gonna come around real quick. So we have to act prudently. One of the things that I worry about, and I think I said this the other night, but I'll repeat this. All those people that choose to get vaccinated or not get vaccinated, what happens if people get sick? Tanya, as you said, many people will get sick. What happens if a lot of people get sick? Are we still gonna be able to operate a hospital? I hope so. I hope we don't have a lot of problems. I hope everybody wears their mask and is as safe as possible, especially this weekend. This weekend could be a very changing moment for Lake County. A lot of people at fair, and it could change things dramatically for us. Let's hope it doesn't. Let's hope everybody stays as safe as possible. But I think it's important for you to know that while we're happy to try and we have tried lots of things to try and encourage the governor and her office to make modifications, she doesn't listen all the time. I can assure you, the times that I've called and talked to people, and she doesn't exactly know me by name, but she certainly knows who I am. She didn't listen, even if I ask nicely. She chooses to make her own decisions. So we absolutely hear everyone's concern and take it very seriously. I don't want anyone to not continue working and being in the family of Lake Health District. We have a lot to be proud of. You have a lot to be proud of. And we have a community to take care of. And that's our obligation. And I think, and I know, all of you take that obligation very seriously.
Thank you, Charlie. Anything else? Okay, we'll move on from public comments. We'll go to the consent agenda. Have you had a chance to read the minutes of the last meeting? Yeah, we've got the calendar for check signing all set.
I so move that we accept the consent agenda minutes for the last meeting.
Second.
Okay, been moved and seconded to approve the consent agenda from last meeting. All those in favor?
Aye.
Passes unanimously. Okay, a little bit safer territory for me, the financial reports, my expertise. Ed, you're on. All right.
This is the financial report for July 2021.
Use the arrow.
I did that. Sorry. Okay, so first slide is patient count. The comparison between 2021 and 2022. You see an acute was 325 for this past month, with an increase of 4 over the previous year. For the clinics, 2206, which is an improvement. Yes, sir.
21 and 20.
21, 22.
So the way the years go is, last year was 2021, because we ended June 30th.
It's fiscal year end.
Gotcha.
And then it goes into,
We're coming into the fiscal year on June 30, 22.
so that's how we identified it.
So clinics 2022 is at 2206, which is an improvement of 420 encounters. Other outpatient services went to 4985, which is an increase of 583 over the previous year. Overall in July, we had 7,516, an increase of 1,007 over the previous year.
That's in 1 month.
Yeah,
Wow.
they're all those different departments are rocking and rolling.
So keep in mind, last year, we shut down completely in March. Remember, because that's when COVID began for us, and so we shut down seeing patients in clinic. We were able to do patient visits by telephone, and very limited. We had nurses and practitioners go and see patients in their car. That's one of the reasons why you see such a big difference.
Right, all right, old fashioned. Gross patient charges, for July was 3.8 million, increase of 29,000 over the previous July, so you see the first. Usually we do this with line graph, but it's difficult to really show the difference, because we only have 1 month so far this year.
Yeah.
But you can see we're trending correctly. For collections, for the month of July was 2.554 million. Should be noted that prior to the adjustments, the cash collections in July were close to 3 million. That's a lot of, there's a lot of adjustments there, about almost $500,000 in adjustments as we sunset different systems. The eClinical one, which used to be in the clinics, we bill out whatever we can and then write off to zero out the balances, or transport to the new system.
So we had just, 1 month before this year where we had some very sizable write-offs, and then now we have some pretty sizable ones
Yeah, it's coming up.
this month. But I guess my question is the dustpan about empty? I mean,
Yes. I think in August you'll see a smaller amount, but these were the big ones that we could shut the system off.
I thought when we had the big loss that month, that was most of, I didn't,
Whether
there
there
was more shoes to drop.
Unfortunately, there was, and it's just to make sure that it's 100% zero balance before we shut it down.
I think part of our team, Jenny, is doing a real good job of bringing things together that have been missed in the past. And you're gonna see that in that dashboard. This 1 month is just 1 month.
Yeah.
I think as we go along, it's gonna get better.
That would sure be our hope.
That would be our hope.
Oh, absolutely. The other
Keep in mind that when we knew we were changing to Cerner, Cerner anticipated and projected that we would see a big adjustment like this. So we did our cash flow analysis before Cerner. We had some very big cash crunch concerns. We were able to mitigate some of it, not all. So while we don't like it, it is predictable.
We had a number of good months in a row, but this is where we're catching up now.
Right.
The other issue too with those sunsetting systems is we're actually manually processing, printing the claims and mailing them too, so there's a longer lag period to see a return on those claims as well. For the actual CPSI, we actually brought that back in-house because we have enough people that can attack it and know it well enough, so.
Is that department getting staffed up now?
Yes.
Right, we're getting staffed up and trained in the departments too. I think the training is important.
All right, next slide. Days cash on hand, 100, which is a large 19-day improvement over the previous year.
A record.
Right. And it's a lot of that is honestly it's COVID grant dollars that they're pushing up. But,
It still puts us in a good place,
yes,
better place.
absolutely. And then this is just the income statement for July. It looks better when we have multiple months to compare it to, so I'm not gonna spend a whole lot of time on that one, but here in the detail maybe is a better place to stop. You see the 3.763 in gross revenue, the revenue deductions of the 1.209, which, you know, on average, it's, I wanna say about 600 to 800 usually. We're trying to get it lower, obviously, every month, that's our goal.
Revenue deductions normally run about 24% of gross revenue.
Right. And so that's, you can see that those big adjustments in there, and that's what makes up that large number. So the net is the 2.555.
Well, I couldn't make it to the finance committee meeting this week, but one of the things you sent out in your packet, I know this is the first month of the year, but if we could see a couple of months side by side, it makes it a lot easier to look at if it's logical versus just seeing that trend.
Yes, no, absolutely, and I actually show that in a few slides here.
So next month though, let's make sure we've got several months stacked against each other so we can look at trends.
No, absolutely, and we actually,
Show that to you.
yeah.
Would you jump to that one real quick?
So this is, I tried to normalize it as best I could, taking out the grant dollars and just kind of go based on the actual real operating over the last 6 months, because it's hard to tell looking at 1 month as far as how you're doing. You know, it's all positive. July, you know, obviously it's on the official statement, it's negative 517 deficit, but 500,000 of that is
The write-off.
write-off, which affects it. So. But on average, it's positive.
You can see the last few months we've had good.
Go ahead.
Yeah.
And, you know, in June, we finished, I think it was plus 9 or 698 or something like that. I removed that COVID bump and just what it really is, truly is.
True operations are.
Yeah.
Yeah.
All right, on the balance sheet, not a whole lot of movement here. You know, if anything, it's a little bit less cash, some of it goes into investment. You still have that restricted cash, 840. The net patient AR is going down. Theoretically, we're collecting more. As well as writing stuff off. Current liabilities going down, long-term liabilities going down. You know, and then the fund balance and going down. That's all I have for this report.
Any questions, Paul? Okay, we'll go down, start right in.
All right. So for Lakeview Gardens, Lake Health Medical Supply, Lakeview Gardens, revenue of $279,367, net revenue, and comparably to last year, that was the comparison we did, was $257,708, so it's an increase. The other part of that is, if you look at down towards the expenses, see the contract labor went down about 20,000 comparatively. That's the educated group from down the hall there.
CNA class.
Yes. So that makes a difference. And I think you'll see a bigger difference in the months to come. Overall, expenses went down a little bit. Comparatively, net income for June was a deficit of 215. So in July, it's only a deficit of 139. So it's sort of trending. For Lake Health Medical Supply, revenue of $35,293. Comparison to July of 2020, it's a $29,907. That's a considerable increase. Expenses actually went down a little, give or take. Had a net surplus of 9,000. And I did the math, it was about $112,000 difference year over year. You put all the ones together, so of improvement. That's all I have.
How are you on oxygen supplies?
Good question that you asked that. Right now, When we talk about oxygen supply, you're talking about for the medical supply, or you're talking about the hospital?
The hospital.
We continue to have the support of Norco, which is the supplier that we have through Modoc Steel, because they get their oxygen supply. We have a big tank that we can convert. One of the frightening things is one of the hospitals that is so busy, they actually, they used so much oxygen that their pipes froze. So there's so many patients needing oxygen, so they had to address that. So we don't have a shortage of oxygen as of now. Let's hope we don't ever get into that position.
Okay. Let's see, Dr. Foster's not here.
But we have another item before we get to that. And this is an unbudgeted item. You have that on your calendar?
I'm looking at my graph, not the.
Okay.
Then you need to update.
Okay, this is an interesting situation. We received in June or July, I believe it was July, in the ballpark of $700,000, about $100,000 for each of the rural health clinics. And we got about $250,000 from the Office of Rural Health through, it was a federal grant. Public Health received around $150,000. All to be used for COVID mitigation and for COVID care. Now, that's a lot of money to try and figure out how to address COVID mitigation or testing. Like, we've had some good suggestions. I like Gerald's billboard, and I like John's buying a van and driving around. We're working on getting some things done. One of the things that we are planning on, we would like to do, is purchase the Gen X system to test for COVID in the clinic. So
We send it out now.
no, we send it to the lab.
Here.
So we send it down the hall to the lab. We can do the test in the clinic. So each of our clinics, the one here and the one in California, could easily do the COVID testing. But what the Gen X does is it doesn't just test for COVID, it tests for lots of other things. So we will be able to use that going forward. So the cost for 2 units, one in each clinic, is $54,000. Now, no, to get a combination. They sell, as is often the case in laboratory equipment, you can either get it for a reduced price, but you have to buy a certain number of samples. You make up your money on the samples. Or you buy a piece of equipment, get the cost of running the test separately. Based on what we think our future is going to look like, or my recommendations would be buy the machines. Use that money to buy this. It will work while we're dealing with COVID, and it will work on all sorts of other testing. I really am concerned about squandering money by buying things that we might never use, even though it seems like COVID is going to be a big deal. Now, I don't think it will be a big deal for the next 10 years. We'll learn how to deal with this. So it's my recommendation that we spend $54,000 of that COVID dollars. We did not budget for this because we didn't know about this. And I would like your approval to go ahead.
But the COVID dollars are mandated to spend on COVID things in this program.
That's correct. That's correct. One of the benefits of doing the testing in the clinic is if a person is exposed, or if a person has COVID, you don't want them walking throughout the hospital. They could potentially spread it to lots of people.
Could public health use one also?
That's a question I don't have an answer today. I'll pose that, and we can, if that's the case, then I would bring back to the group next board meeting that we would buy it in the interim. But right now, I don't think that is what we would plan.
John, first off, for the covert, it's a big plus. You mentioned that it could be used for other things. Could you just give a couple of examples just for the audience? Myself to know what other things it could test for.
Excuse me, we have a
I
comment.
was gonna say I could help you, but Teresa's.
Deborah can get, because she knows it much better than I.
But, or Teresa, did you want to say anything?
Said it's primarily influenza, but there's some other viruses that I can't quote.
Yeah, it tests for influenza A, influenza B, also the respiratory syncytial that the little kids get. And it's going to also be adaptable after November to do GC and chlamydia, some of our STDs.
That's the part I didn't want to say because it still hasn't been approved. But yes, that would be a good thing.
Paying it forward, future forward.
So it has a lot of benefit that, and that might be one of the reasons why we might consider it for public health. And I can't answer that because that is often a test that we run in public health. So it's very possible that that's a good suggestion. Okay,
Okay.
Well, I think it makes sense, we have funding for it, it's earmarked for specific uses, and this is specific use.
Well, it's not gonna be just a one-thing deal, it's something we're gonna be able to use for a period of time. So Chairman Don, I would make a motion that we accept Charlie's recommendation to purchase 2 GenX testing systems in the amount of $54,000.
Okay, moved.
I'll second.
Been moved and seconded to approve the purchase of the GenX IV4 systems. Question? Yes.
One to be in a clinic here and one to be in a clinic in Arcturus, you said?
yes, sir, that's correct.
And how would public health interface with that?
So then the option of having it in public health would mean that the equipment, and it's a desktop, like a little, looks like a printer.
Yeah, I'm thinking about the public health department.
So
You'd buy another one for public health.
a
Later,
third, 24,000,
A third.
27,000.
23,500.
Unless there's a volume discount for buying 3 of them, then maybe.
I asked that on the 2 and they said no. I asked.
What's
Doesn't
also
hurt to ask.
important to know is the accuracy of this piece of equipment is virtually the same as the one that we run in the lab. So sometimes you have the option of getting sort of light pieces of equipment that are pretty close, but not as accurate. This is very accurate equipment. So it's, we're not squandering.
Go ahead, I'll move on.
Okay, been moved and seconded to approve the purchase of the systems. All those in favor? Aye. Passes. Already get to spend some more money, good. Okay. Now it's medical staff update, Matt Foster,
Dr. Foster said he would try to get here, he's not here right now. Did we have
We
any?
didn't meet.
We did not have a meeting, so we don't have any items that we need to.
So there's no update there? Okay.
Correct.
So the nursing report, Teresa, you're up.
Well, I can report that, the good news is for Ed, we've been busy. Quite busy, and, we do have several, COVID patients. So that challenge continues, the nursing staff do a great job of caring for them. We had an interview and the job offer, which was accepted for a new cardiopulmonary manager. So her name is Kim McFall, and she'll be starting in less than 2 weeks. So that's good news. We also did an interview for the surgical services manager. We have yet to know whether or not he will be taking the job. So we've been busy with that. We've also had the transition of the CNA students out of class, and they've applied for jobs. They still don't have their certificate through the State Board of Nursing, so we're still waiting for that. But I have 3 applicants, so I'm very excited. We interviewed them, we're just waiting to see what happens, so that's also really good news. So,
If I could just add on that,
yes.
on a call I was on this morning, the State Board of Nursing had 2,000 applications that they were trying to process. And they got through them yesterday afternoon. So, because that was a big issue for the state of whether or not we could get applicants or people working. So they claim that we should now know much quicker.
For your information, my daughter got her registration this afternoon.
Oh, so maybe more of them did, yeah, okay, good to know. We will have 1 nursing student starting back with us this fall, so it's 2 years, so this is her senior year. So we can look forward to her graduating next spring. We do have several more international nurses slated to come on board, which is a help to us. We have not had applications from new graduates the way we used to get in the past, from out of the area. So we have that process in place. I think that's all that I can think of on the nursing front.
Okay. Thank you. Just a quick aside, how are we doing in radiology for a minute?
So what we are missing in radiology is an MRI tech, MRI technologist, and we've hired 2 people to come, 2 travelers unfortunately, but that will, they're in CT, so that will improve. And we have an MRI traveler tech who will be starting in about 2 weeks, give or take. So we continue to look, but we have somebody coming, irrespective. So.
Okay, thank you. Any other questions for Teresa? Okay, we'll go right to the CEO report.
So as you can imagine, it's been a quiet week again and or month in the hospital. We've spent an enormous amount of time on COVID, trying to figure out vaccine mandate, how we would deal with that. And it's an issue that's affecting everyone. It continues to be a challenge for us to deal with hospitals that can't accept their patients. One of the things that Teresa and I have talked about doing is we approached St. Charles and Sky Lakes about accepting additional patients in our swing vet program to accommodate their overcapacity, part of their problem. In order for us to get patients to them, they have patients they can't get out of the hospital because they are not able to get them into a nursing home or into a different facility. So to help take patients that can leave, because while they still may need care, they don't need to be in the acute part of St. Charles, the very, very acute part, that they could come here. So we're in the process of accepting more of those patients, and that will put more people in our long-term care as well as in our swing vet program. Both hospitals have expressed a great deal of gratitude for that, understanding that we're trying to work with, because each of the hospitals are overwhelmed.
So in other words, if we had a patient that say has a heart attack or something, it needs to go out, for something we can't deal with here, then we essentially trade the patient back so we can move for somebody from Lake County that needs.
It sounds
quite
something
that
like that, but not quite.
It's not quite that smooth.
So typically, if a person needs to have care that is urgent like that, or very emergent, we want them to go right to that other hospital.
But will they take them now? They won't take them.
Sometimes we have to call several places. They don't have
We've had to
the
transfer
capacity.
out as far as Boise to get a hospital to take them.
It's becoming a bigger and bigger difficult issue. I was advised, I sit in on the St. Charles planning for how they're dealing with things. And I was related of a case that went to Prineville. They went to St. Charles, had a procedure done there, and went to Prineville to recuperate, and then back to St. Charles for something else, because they just didn't have the beds. So they're doing a lot of transportation between facilities. So what we're offering is to provide the transportation for somebody who could leave St. Charles Bend Hospital, come here, be here for, could be a week, could be 10 days, it could be 2-3 months, and then take them back to the Bend area. Or in the case of Skylakes, they would go back to Clear Falls.
Now, you mentioned long-term care also as an option. That's pretty tight, restricted, getting into that. How would we facilitate getting people into long-term care?
We work through the process. So we're not quite as restrictive as we were a year ago. We're more able to accept patients. So, and remember, people are coming and going all the time. So this is a process. But we think this will help alleviate some of the problems, and we'll continue to provide. We have staff that can provide that kind of care as long as we can keep doing that. That's what our goal. We've had, we've sent out to you updates on grants, and we've got some new grants that are pretty impressive. We just received a $200,000 grant from what's called SAMHSA, or the Substance Abuse and Mental Health Services Administration. This is one of only 32 grants awarded nationwide, and we are one of 10 that receive the maximum amount. What that money will do is it'll go toward providing emergency medical responder and EMT classes in Lake County. We are working on being able to train more people to be EMTs or EMT basics at different levels of that.
Would this bring people from outside of the county to here to train?
Conceivable. Would also take people within the county that may be in more remote parts of the county that want to get trained. People that want to volunteer, people that want to provide service. So, and of course, if we find people that can qualify and get through the class, they could be people we would hire. So that's good. Plus, it would purchase new hydraulic extrication equipment, train staff and volunteers on how to use it, and would provide mental health first aid training. So it does a lot of things. And it's very exciting that we got that. We were quite surprised and pleased that we got that grant. We got another grant from the Oregon Community Foundation, and I'll send all this out to you.
Good.
So that it gives you an idea. That in the amount of $150,000. This is for a program to support the Sources of Strength retreat for Lakeview High School peer leaders. And we're going to be developing something that's going to be unique. It's a pilot program. It includes audio and video podcasting, guitar lessons, and photo voice to give youth an opportunity to express themselves, deal with some of the anxiety that a lot of people are facing. And we're looking at locations right now where this will happen. So a lot of it will be done in the next 4 months. And hopefully if we get this extended, we'll continue into next year. I'll send this out to you.
This is with the high school, is it in conjunction with Lakeview High School?
It is. Yeah. So pretty exciting to have this kind of thing. And there's no question we have lots and lots of people that are, this is a stressful time. So it has changed for many, many people. And so giving people opportunities to use that, learn techniques to address their stress is very positive. When Ed talked a little bit of our emergency medical supply company, we spent a lot of money last year and the year before having a consultant help us do a really good job to improve our services. We found that some of the things that we had done, we thought were good, but he had some improvements in terms of suggestions. We changed software, we changed some processes. And we also hired or promoted one of our techs to become the manager. We just had our recent survey. As you remember, we also bought a building to put the medical supply in along with the business office, the 220 building. When we announced we were going to move in June, and then we couldn't get the door. Remember all this? Finally got the door, finally got the ramp, finally got them in there. We expected the survey to come by anytime from June 1st going forward. They showed up last week. And they said it was the best survey they'd ever seen, that what normally takes several hours took them about 10 minutes. They said it was extraordinarily good. So we got exceptional marks. It was well organized, beautiful location, and they were just greatly impressed. So I think that's a great thing for us. And Alan is to be commended for
Kudos for the team.
and for the whole team. Everybody did a lot of work on that. So that's a positive. Thank you to all of you that participated in the SDAO training and some of the other components. We now have a 10% discount off of our insurance because of our efforts to go through those trainings. That's a good thing. Last thing that I think I would like to address is at the last board meeting, talked about our interest in dealing with our EMS equipment lease. And we have, as you know, September 1 has passed, and so our lease was for a year. And at the end of the lease, we would either continue to lease, buy the equipment, or choose to do something else. We recommended at the last meeting that we would buy the equipment. Given that there's still some uncertainties about how things are working and to ensure that we preserve our cash, I think I'm going to talk with the board, the disaster unit, about extending the lease for another year so that we have a better idea. Now, we may not come to a final resolution with them, but it just feels like it would be a better solution for us to continue that for another year. Tyson and I have talked about that, and that might help alleviate some of the anxiety about all sorts of things. So,
The equipment still remains at our disposal, either way.
yes, and we will continue to maintain it and continue to do all the things. We just, we will need to get into a timeline of replacing equipment and bringing in newer equipment all the time. But that's a lot of money. So we want to watch how we manage those dollars. So that's my recommendation. That's about all I have.
Usually our meetings, we have COVID numbers on the board. Could you share a little bit about what we've seen in the county?
Yes, I can. A week ago, we had, on Monday, we had one case or two cases in the previous 10 days. As of Wednesday, we had 14. As of Monday this week, we had an additional 18.
So that means 32.
So COVID, this Delta variant is highly contagious. And we have seen some people come into the hospital, so it does affect everyone differently. But the numbers are escalating. I can't tell you exactly how many there are today. Judy Clark is out this week because of an unfortunate death in the family. So I don't have all the exact information as of today, otherwise I would.
Do you know if there are any children?
I don't know that for a fact. I can't answer. One of the things that does happen is we test lots of people. And more people are asking that we test them, and we're able to do that. But we also have what are called presumptive cases. So if it's in one family, and they were all together, and 3 out of 5 show or test positive, the other 2 were kind of presumptive. And so we treat a presumptive and a positive test the same. All have to be in quarantine and confined. So I can't answer that exactly.
Is there, of the 30 some odd, were there any cases that associated with people already vaccinated? If you can answer.
I don't know the answer to that. I read just before this meeting that throughout the state, I think they're called, not pass-through, but breakthrough, thank you, breakthrough cases. And there is a percentage of people that are testing, or that are now experiencing COVID, that are breakthrough cases. What I think we have to keep in mind is lots and lots of people who get that, even get COVID, even if they are vaccinated. The difference is how sick they get. And so some people have very mild experiences, some not so much. So telling part is how sick. Other questions I can address? I tried to beat Gerald's time.
Thank you, you're doing very close.
7:37.
You'd be within 7 minutes.
Gerald, I can't beat you, that's too bad. Okay, we'll adjourn into executive session under ORS 192.660, bracket 2, bracket A, personnel, bracket C, medical staff, bracket E, real estate, and bracket H, legal. And we'll take a 7-minute break.